Hi, Steve Hines here. Just wanted to follow up from the message I sent you a couple of days ago, and it's just to elaborate on a lot of the questions that I get from patients with low back pain about specific pathologies. And the one that I come across the most, one that creates the most fear in people, is having a slipped disc. Okay? Now it's a bit of an erroneous term because the disc is not a hockey puck type of thing that sits in between the bones that slips in and slips out. Okay, it's actually predominantly water. At its center is a gelatinous ball bearing, and it's surrounded by rings of ligament tissue. And what happens is really you get something called degenerative disc disease, not a disease, but degeneration in the discs, and they start to wear thin, if you like. So the bones start to come a little bit closer together, and the water that was in the disc gets sort of squashed out and the disc flattens off. Now, it's not a great thing, it's a degenerative process, and what it can cause is disc bulges at the back of the disc where the spinal cord and the nerve roots are. Now, I mentioned to you in the previous video that I sent you that if you have any changes in your bowel or bladder habits or lack of sensation around the genitals and back passage, that is fairly serious, and it can be a disc bulge actually pressing on the spinal cord, or what's called the cauda equina. It's called cauda equina syndrome, and that is not good, and you need to get off to A&E. But most of the time when people have a disc bulge, it's pressing on the nerve roots at the side of the side of the spinal cord, if you like, and they're the nerves which go out and down the legs if we're talking about low back pain. Now, if there's pressure on a nerve, you're going to block the information through the nerve. So there's going to be some pins and needles and some numbness. Not necessarily a huge problem. If you're starting to get accompanying weakness, particularly in your big toe and your foot, that's a bit more of a cause for concern. However, it's not a medical emergency, and it can improve over time. But if there's pressure on the nerve, it will create pins and needles and numbness. However, if there's inflammation in the nerve, from some of the disc material, and you've got that's touching the nerve, and there's an inflammatory response in that part of the body, that is extremely painful, and it sends pain down the leg in the distribution that the nerve feeds. Okay, so that's why you might be getting some of this pain down your leg accompanying your back pain. So having a slipped disc is not going to mean you're disabled, you're going to end up in a wheelchair. It doesn't mean you've got a crumbling spine. There's nothing seriously wrong. Without trying to make too light a point of it, the symptoms that you've got in your back pain, and the pins and needles and the numbness and the pain down the leg can completely resolve. Now, the disc won't slip back in or relocate. It's just a degenerative process, but it can get better. So I hope that just highlights or explains for you a little bit better this term slip disc, and remove some of the fear around it. If you've been told you've got a slip disc, it can completely resolve and you can have no problems with it in the future. So again, implement the advice that I've given you in the free guide, and I'm sure your low back pain by now should be starting to get better.